Today's question: what are nurse-managed health centers? The simple answer: it's about improving health of communities. Nurse-managed health centers provide care for people served by Medicare, Medicaid, and children's health insurance programs. Many nurse-managed health centers have gathered together to have a stronger presence. The largest support organization is the National Nursing Centers Consortium. We will use the NNCC as an organization of study. They are a group of 250 nurse-managed health centers across the United States that serve 2.5 million persons. Although run by nurses, they employ physicians, social workers, psychologists, faculty, nursing students, volunteers, and community outreach workers. Services include primary care, family planning, prenatal services, mental and behavioral health, health promotion, and disease prevention. Most national nursing centers are associated with nursing schools, and over half are community-based, non-profit organizations. One of the ways that National Nursing Centers Consortiums helps nurse-managed health centers is through its important policy work with federal, state, and local government. They help establish best practices locally in a few centers and then spread them out nationwide. Their goal to health centers are for them to receive optimal reimbursement from third-party payers, to provide training and grants, data collection, and overall support for its members nationwide. Let's take a look at Lisa. She is 35 years old with a partner and 2 small children living in Philadelphia. She is served by the 11th Street Family Health Services. When the nurse first came to her community, the residents were skeptical. The nurse responded to their needs and immediate concerns with stop signs, animal control, food assistance, and CPR classes. After the nurse built trust, the health center began providing primary care. So now Lisa can get her children's immunizations, management classes of her asthma, her partner's diabetes, receive health care, and participate in centering parenting classes. The center is also providing health promotion classes. If Lisa wants to learn better nutrition, she can take cooking classes using local produce. She can join a fitness class with a full-time trainer that is on site. She can learn about disease prevention, like lowering blood pressure to avoid disease. And now all of her health appointments include behavioral health and social work. Nurse-managed health care statistics indicate some good outcomes. Data show specialty costs are 25% less than other providers. Prescription costs are 25% less with more generic prescriptions. Maternity stays are 35 to 50% shorter. And for 6 years, medical encounters are 11% less than encounter costs with other types of providers. From unpublished outcome data from the 11th Street Family Medical Health Services of Philadelphia over an 18-month period, there was a 94% performance rate for things like immunizations. The patient satisfaction rate was close to 100%. The number of glycosylated hemoglobin levels less than 7% doubled. LDL decreased, blood pressure decreased, depression decreased, birth weight increased, and breast cancer screenings increased. Nursing centers also allow nurses to practice in an optimal way with record-keeping, billing, and database outcomes by purchasing a software called MySys, which is an electronic medical record and practice management software for their clinics. The system provides data for nursing centers in the network, is able to track clinical outcomes, and track nursing interventions over time. Studies show high-quality care with comparable outcomes to physicians to nurse practitioners. Decades of research has examined this question. Moreover, no studies suggest that care is better in states that have more restrictive scope of practice regulations. Nurse-managed health centers are key to today's healthcare problems because physicians, nurse practitioners, and physician's assistants provide the most primary care in the United States: 287,000 doctors, 83,000 nurses, and 23,000 physician's assistants. While the number of NPs and PAs are increasing in primary care, the number of physicians are decreasing. Both PAs and NP numbers doubled from 1995 to 2009 in primary care. With the Affordable Care Act, 32 million new persons will need primary care. Where will the care providers come from? This is like 87,671 new patients every day for 1 year, or equal to the number of deaths of 47 Hurricane Katrinas every day for a year, or equal to the number of deaths of one World Trade Center catastrophe per hour for 1 year. The growing use of nurse practitioners and physician's assistants have eased the bottleneck of patients needing care by reducing wait times, increasing patient satisfaction, and freeing physicians to handle complex cases. The largest challenge to nurse-managed health centers and National Nursing Centers Consortium is sustainability. Most nurse-managed health centers depend on charitable grants from private foundations. To achieve true sustainability, they must receive fair reimbursement. But state and federal laws allow unequal payment. Moreover, Medicaid and Medicare pay NPs at differential rates of 65, 75, and 85% of physician reimbursement. In a survey of 222 managed care organizations, only 56% of companies reimbursed at the same rate as physicians. Many insurances also view NPs as primary care providers of last resort. Outside systems support this through pressure like the American Medical Association, and actually states through various nurse practice that changes according to state lines. One large example of the issue of sustainability is patient-centered medical homes. This idea was originated by physicians and do not permit management by a nurse. So although the 11th Street Philadelphia Clinic meets the criteria set by the National Committee of Quality Assurance, they cannot be reimbursed as a PCMH because they have been led by nurses. They were recently denied payment for its care coordination, impacting the center's sustainability. This problem is evident for all 250 NMHCs across the nation. In summary, nurse-managed health centers have come together. They have created and formed an umbrella organization called the National Nursing Centers Consortium. Together, they detour illness and support the purpose of community health across the United States. As an organization, NNCC is trying to raise the level of public awareness of nursing. They are attempting to make NPs visible, track NP outcomes, promote nursing parity by asking for equity payment for nursing services. Currently, they are limited in sustainability due to systems outside the organization like unequal pay from insurance, pushback from physician-led medical care homes, and fragmented variations in the level of care they can provide. But they are providing quality health services through the use of nurses in creative ways that are affordable and accessible. Thank you very much, and I hope you enjoyed this presentation on National Nursing Centers Consortium.